Hello everyone. Let's see about embryo transfer in human. So what is human embryo transfer? Human embryo transfer is a medical procedure commonly used in assisted reproductive technology ART such as in vitro fertilization IVF to facilitate pregnancy in individuals or couples who are facing fertility challenges. It involves placing one or more fertilized embryos into a woman's uterus to facilitate pregnancy. An embryo transfer is the last stage in the IVF process. Embryo transfer can be done at day 2 or day 3 or later in the blastocyst stage, which was first performed in 1984. The embryo transfer procedure is done by loading the IVF embryo into a catheter, which is then passed through the woman's vagina. In this picture, we can see the procedure of IVF, where the first stage is the ovarian stimulation. Here, the woman is given hormonal treatment to stimulate the egg production, and the second step is the egg retrieval. Multiple eggs are taken from the woman's ovary, and the third step is the sperm collection. The sperms are collected from the male partners on the same day of the egg retrieval. The fourth step is the fertilization, where the sperm and the egg get fused in the lab and left for several days. During this time, embryos are monitored to ensure that they are developing normally. And the last step is the embryo transfer. Once the embryos reach a certain stage, that is a 32 cell stage, one or more embryos are transferred into the woman's uterus using a thin catheter by ultrasound. So when embryo transfer is needed, the IVF of the embryo transfer is needed in case where natural fertilization is not an option or has difficulty occurring. So there are some reasons. The first one is the ovulation disorder. If the ovulation is infrequent, fewer eggs are available for the successful fertilization. The second step is the damage to the fallopian tube. The fallopian tubes are passage through which the embryo travels to reach the uterus. If this tube has any damage, so it is very difficult for the fertilized egg to safely reach the womb. The third is the endometriosis. When tissues from the uterus implants and grows outside the uterus, this can affect how the female reproductive system works. The fourth one is the premature ovarian failure. If the ovaries fail, they do not produce normal amount of estrogen or release eggs normally. Next one is the uterine fibroids. Fibroids are small, benign tumors on the walls of the uterus. They can interfere with the egg's ability to plant itself in the uterus, preventing pregnancy. The next one is the genetic disorder. Some genetic disorders are known to prevent pregnancy from occurring. The last is the impaired sperm production in men, low sperm production, poor movement of the sperm, damage to the testes, or the semen abnormalities are all the reasons natural fertilization may fail. So the process of embryo transfer, so the doctor will insert a speculum into the woman's vagina to keep the vaginal walls open. Using ultrasound for accuracy, the doctor will then pass a catheter through the cervix and into the womb. From there, the embryos are passed through the tube and into the womb. The process is usually pain-free and rarely requires any sedatives. Some women may feel discomfort as a result of having the speculum inserted or from having a full bladder, which is required for ultrasound. The process is very short and the bladder can be emptied immediately after the process. After the embryo transfer, a follow-up appointment 2 weeks later to check the embryo has implanted will show if the transfer was successful. After the procedure, women may experience some crampings, bloating, and vaginal discharge. Here in this picture, you can see the catheter where it is which is inserted into the vagina. The transfer of pre-implantation embryos may be accomplished either surgically by making an incision through the abdominal wall and exposing the uterus, or non-surgically by gaining access to the uterine lumen through the vagina, the latter being more common. The doctor inserts a speculum to the woman's vagina to keep the walls open. So here they'll insert the catheter. So the embryos are passed through the tube and into the womb. So here the embryo transfer is most commonly performed after 72 hours, and the blastocyst transfer is genetically performed at 120 hours. Here, types of embryo transfer. So once the fertilization has occurred, there are few different options available for the embryo transfer. The first one is the fresh embryo transfer. Once the eggs have been fertilized, they are cultured for 1 to 2 days. The best embryos are chosen to transfer directly into the woman's uterus. The second one is the frozen embryo transfer. Any healthy embryos that were not used in the first transfer can be frozen and stored for the future use. These can be thawed and transferred to the uterus. The third is the blastocyst embryo transfer. If many healthy embryos develops after fertilization, it is common to wait to see if the embryos develops into a blastocyst. Assist hatching before transfer. Assist hatching is performed in the laboratory just before embryos are transferred into the woman's uterus. By using a laser, the embryologist makes a tiny, precise opening in the shell of each embryo, after which it is transferred. So, during this embryo transfer, there are so many risks we are facing. There are minimal risks associated with the embryo transfer procedure. So the risk mostly related to increased hormonal stimulation, causing an increased risk such as blood clotting. The woman can experience bleeding, changes in her vaginal discharge, infections, and complications of anesthesia if it is used. The greatest risk of the embryo transfer is the chance of multiple pregnancies. This occurs when multiple separate embryos attach to the uterus. This may increase the risk of stillbirth and the children born with disabilities, and is more common in pregnancies due to IVF than natural conception. Thank you.